So this paper is about how we can improve cancer outcomes. Now in this paper we focus specifically on using and collecting data better in order to do this. And what we say in this paper is actually data can be better collected and used throughout the whole treatment pathway. So from prevention and early diagnosis all the way through to recovery. The data that the NHS collects is one of its greatest assets, but at the moment the NHS isn't always transferring that data into insight and really using that insight to drive improvements in care. Now what we say in this paper is that we need to be doing this in cancer, and if we can turn data into insight, this means that doctors will be able to make better decisions about patients' care, but also will be able to do a lot more around preventing cancer being diagnosed in the first place, and also helping those who are developing cancer, giving them sort of earlier diagnosis. And there's been a lot of research that's shown that if your cancer is diagnosed much earlier on in the treatment pathway, then you'll have a much greater chance of survival. So in breast cancer, for example, if your cancer is diagnosed at stage 1, you'll have almost 100% chance of surviving up to 5 years, whereas if your cancer is diagnosed in stage 4, your chances drop down to 30. So the good news is we already have the infrastructure there to do this. The cancer dashboard was set up by Public Health England a few years ago, and what we say in this paper is this dashboard needs to be improved and extended so that it becomes the single point of access for all data on cancer outcomes. And it should not only include data on cancer outcomes, but also look at pulling on data sets across the whole cancer pathway. So data around treatment, data around patient experience, and data on a patient's medical history. One example that we actually talk about in the paper is the 100,000 Genome Project, and how in the future the cancer dashboard could be linked with data from that, so that we can actually look at how a patient's genetic profile might affect their outcomes and what treatments they best respond to. Now, obviously, all of this is going to be dependent on having a secure system in the NHS for storing this data, and for patients to give their consent for the NHS to link this data in the first place. So as a patient, this model of using data better will mean that I will have a far more personalised and integrated care experience. So if, for example, I'm identified by data as someone more at risk of developing a cancer, I could sit down and have a one-to-one appointment with my GP, and they would present me with different options for how I might, say, improve on some of my health behaviours. So they might advise me to change my diet or join an exercise class. Now, if I was again someone who was at risk of developing cancer, data might be used to send me personalised information, encouraging me to go to screening. And when I was at screening, good quality data could be paired with artificial intelligence in order to improve the accuracy of my screening test. Now, post-diagnosis, if I did develop cancer, this data could be used so that I could receive personalised medicine that was specific to the genetic profile of my cancer tumour. And this should hopefully be more effective, and I will respond better to this than I would if I was receiving a blockbuster drug like chemotherapy. Now, once I had received my treatment, I would also, in recovery, be, say, given a Fitbit or a wearable that would track some of my behaviours, my sort of exercise, my lifestyle, and doctors could monitor this information and potentially help me make healthier choices and also intervene earlier if it looked like my cancer might be returning. Now, the final thing is, as a patient, I would be given the opportunity to evaluate and feed back about the care that I had received, with the hope that going forward the NHS could continuously improve the cancer care it was giving to patients.